chart, Dave, that shows him like what he's doing.
This is probably going to be bad. I'm prepared for a low
right.
score.
Yeah. Well, this is what we tell patients is, you're going to go ahead. We're going to get a nutritional reading. Just find out,
Can I pause before you do that?
Absolutely.
So, I mean, how do you get in that discussion with them? I mean, I'm assuming you pull them in. Are you doing this for every patient?
My whole career, I've preached nutrition.
Okay.
Especially to OBs. Because one of the things that happens with obstetrical patients is they can get toxemia, PIH, pregnancy-induced hypertension. I've pretty much eliminated that in this practice. I had 2 patients that I just transferred to other doctors because they didn't listen to me, and they have 34 weeks gestation, and they got bad toxemia.
Here's your score.
So you're at
Typically,
20,000.
so what we'll do is we'll
Nice.
give you a score, and you can read it. See, you're only 3,000 higher than me. At least you're in the orange zone. I was in the red zone.
So this is an old booklet, and I love this booklet. So here's Oz at 75,000. We measured somewhere around 50 to 80 million Americans, and they averaged 23,000. Ironically, the 300 studio audience members on that show that day averaged 23,000.
Right.
Oz was blown away. He said he thought everybody was going to be an A or a B. So if we scan 100 people, one's an A, two's a B, and 97% of America is in dire straits.
I believe that.
Isn't that amazing?
Yeah.
I never thought that would be the case. So here's the other thing. We know that there's a correlation between fruit and vegetable servings. 3 or less is going to put you at a conservative risk 5 times greater for cancer, diabetes, heart disease. The literature is replete with antioxidants in fruit and vegetables. For 70 years, it's in PubMed. All you got to do is do the research. Doctors have forgotten the basics. That's why I have a picture of the cell here. Feed the cell, which feeds the tissue, which feeds the organ, which feeds the organism. That makes sense.
Pretty simple.
Stop stealing my lines. It's pretty simple. So with you, we have, as KP said, a performance guarantee. If you take that score at 20,000, we guarantee you. Now, by the way, we have over 200 different products, and we're now at the science of epigenetics. But let's just talk about inflammation, the secret killer. That's why I have those 2 Time magazines. The secret killer. Inflammation is the precursor to disease. Everybody pretty much gets that. Oz was really, that show was imperative because it really brought forth that magic antioxidants. Now it's in, it's got, my cereal has antioxidants, my skin products I have antioxidants in my hair, Antioxidants, the word's thrown out all over the place. This product right here was invented probably about 20 to 25 years ago by Dr. Joe Chang, who left Big Pharma, left Wyeth. And what he based it on was cell biology. So there's over 100 products in here, over all your vitamins and minerals and micronutrients. That's okay, that's a start. But if it's that alone, you're not going to change your cellular health. So they put in the 4 fish oils, EPA, DHA, omega-3s, krill. Krill's a crustacean, raises your HDL. Anti-cancers, okay? And then all your antioxidants. Now, the original product was called Life Pack, and it was an amazing product. We still have it. But he took it to a whole nother level, and he created this carbohydrate moiety, which prevents the lipid products mixing in your stomach with water, because that is going to do what all your other vitamins do, is going to clump. So this little word nano, it's kind of a misnomer, but we'll take it. It basically is going to allow conservatively, KP gets mad at me, but I always say 5 to 10 times absorption. We'll take 5 times. We'll take